I'm going to apologize to y'all right off. There's a log jam downstairs. Actually, a lot of people trying to get up, and it was very difficult to get here. And any of you that were here yesterday know we were in a freezing room, and I think today they've warmed us up a little bit. So if we could, just a minute, I want to see, yesterday afternoon we had a long time for comment, and we had a couple of people that were kind enough to sort of give up their slot, actually, because we had another committee meeting coming in the room. So I'd like to give them just a few minutes to talk on public comment, just those two, and then we'll come back to the regular format, and then at the end we'll open it up again for comment from anyone who might be here. So I believe Wayne Drummond, were you here yesterday? Yes, please. Let's see, do we have him on? Okay, whenever you're ready.
Madam Chair, members of the committee, my name is Wayne Drummond. I have the privilege of being the Executive Director of the Georgia Professional Human Services Association. That's a mouthful. We represent 2,100 persons who work in human services, family and children's services, and folks affiliated with our system of service. Let me start by thanking this committee and the General Assembly for all the wonderful things that have been done in recent years to improve Georgia's child welfare system. And we're grateful for the continued support of Governor Kemp in this current budget. If I say anything that makes you want to redirect the existing budget, please ignore that. The department has excellent leadership. Our association exists to support the department. There were a few items in the department's request that did not make it into the governor's request. One, the department requested 26 positions for adult protective services. 12 were recommended. The department requested 10 guardianship case managers. 5 were recommended. The department requested 100 adult Medicaid positions, and 50 were recommended. Lastly, the department requested some funding that sort of gets into the weeds, but to adjust the salary structure for folks that work in child welfare. There were folks that were left out of the adjustments who do direct child welfare work, and the department requested a small amount of money to correct part of that problem. What happened is that, for lack of a better term, they ran out of money. They appropriately put the money on the front end of service to allow us to recruit new caseworkers and supervisors. But there were people who are program administrators and managers who also work in child welfare that were left out. So basically, our position is we've proven as a state that reasonable workloads make a difference in our ability to serve children. Having people to protect vulnerable adults is important. Having them have a reasonable workload is important. If you want folks to get access to medical care who are vulnerable adults, providing enough case managers to help them and also to assure the integrity of programs, it's important. We believe also it's important that our salary structures within the department make sense, that you shouldn't have a system that allows you to hire new supervisors who make more than folks that report to them who were left out. I just would appreciate any consideration that you could give if you find additional resources. I think these are worthy goals. As a person who is aging, I encourage you to listen very carefully to all of the aging advocates yesterday, every day in every way. That's personally important to me. Thanks for your consideration, for your deliberations. Best wishes on sorting out all of these competing needs, and I thank you.
And thank you so much. Are there any questions at all for Mr. Drummond? Okay.
Thank you.
Thank you for your good work. Appreciate it. Okay, and next, Ellen Reynolds.
Thank you, Madam Chairman and members of the committee. And I have the privilege of standing before you today as the Executive Director of the Georgia Child Care Association. And I want to first thank you for the work that you do because you all are tasked with caring for the least of these. And I'm here to talk today to really echo some of what Director Rawlings said yesterday on a specific line item. It is in the House tracking document 26.6.8. It's $867,000 and change for child care placements. And I just wanted to give you a little more perspective about that. When we moved all of eligibility over from DFACS to DECAL about a year ago, December. And it's been largely a good thing, except for when it comes to placing foster children. Because what's happening is frequently you have emergency placements that are made in the middle of the night or made, even if it's during the day, still an emergency placement. And the first thing on that caseworker's mind is making sure they're taking care of all those kids, not getting to the paperwork of making a referral to DECAL. DECAL cannot pay for child care for foster children until a referral is made. That's per federal law. So what happens is you get providers left for a week or 2 weeks or even 4 weeks without a referral, and the only way that they have of getting reimbursed, DFACS does have some emergency child care funds, but it's a very convoluted system right now that makes it almost impossible to get the funds, because you have to go, the child care center owner has to go to the DFACS county where the child's case rests, which may not be where the foster parents live or where that child care center is. And you have to go to the county manager and ask for the county manager to go back and approve child care for the weeks before the referral was made. That is not happening in a timely manner. So we met with Director Rawlings, and it's really one burden that county DFACS directors don't need. So we met with Director Rawlings in December and talked about how we could try to fix this problem. And he agreed that it would make more sense to have this be a centralized intake process or reimbursement process at DFACS, so that we can get these referrals made timely, hopefully so that there's less state funds and we're using the federal funds, but also so that we can get providers reimbursed, because what is happening unintentionally is some providers can no longer afford to carry those losses, and so you're seeing less and less providers take foster children. And we don't want that. We don't want a situation where we have, like with dentists that don't want to take Medicaid because they can't get paid. So that was sort of the genesis of this request. And so I just humbly ask that you would support that request in the budget.
Representative Oliver.
Is the daycare center able to be reimbursed from the day the child starts or from the day of the referral? How much do they lose? How much retroactive do they get?
It all depends. They cannot be reimbursed via CAPS, the federal funding for the foster children, until the DFACS worker makes that referral in writing to DECAL. Now, DECAL will go back and make it retroactive. It still can take DECAL a few weeks to get the certificate in place and get it going, but they will make it retroactive to the date that they got the referral.
The piece of paper, but not the first day the child was there.
No. So we have children in care for 2 to 4 weeks that providers are not getting reimbursed for. And when I mentioned this funding in the budget, literally I put it out in an alert today, and I had several providers say thank you for fighting for this, because we've just about stopped taking foster care children because we can't afford it. So, and we don't want that to happen at all.
Are there any other questions? Representative Howard.
Thank you, Madam Chair. So if I'm understanding you right, that 2 to 4 week period, the daycare receives they don't get back pay or any?
The only way they could is to have to go to the county DFACS director in which the case sits, not where the child is living presently, not where the foster parents live, and those can be 3 different counties. So they have to track down where the actual case is sitting, because if a mom moves from county to county after a child has been removed, then the case gets transferred from one county to another. So they have to track down what county it's in and then make an appeal to the county DFACS director of that county and ask them for the funding to be reimbursed out of the state's emergency child care funds, which I think is just general state funds that DECAL has to address all kinds of needs for foster children. Yeah. And it's not working, and this was, Director Rawlings' brilliant solution. We said, is there some way we could centralize this process so that we are encouraging and making sure children are getting referrals promptly, children are getting taken in, you're not having to have a DFACS caseworker looking for 2 or 3 different centers before they can find one that will take a foster child. And so we don't have child care centers running losses of, I've heard of run losses of $4,000 on a single child.
Representative Mathiak.
Thank you, Madam Chair. On the, I'm hesitant on the centralization because of some things that I have heard in my county when a foster parent's trying to get a hold of a worker and they have to go through that central phone system. Tell me this is separate.
No, this is separate. This is
Okay.
purely streamlining. When all the eligibility got moved from DFACS to DFACS used to have 85 eligibility workers that were there at DFACS to help streamline this. This is in part so they can hire some of those staff back so they can facilitate those referrals to make sure that, because we'd rather the feds pay for it than out of the state emergency funds,
Sure.
right? So part of what DFACS wants to do is make sure those referrals are getting made in a timely manner. And it's a burden that I think it will absolutely facilitate things rather than, if I'm a caseworker and I'm worried about children in danger, and I should rightly be worried about those children before I'm worried about making a paper referral so that somebody gets paid for care. As long as I've got that child in care, I'm moving on to the next crisis, because I think that's what they have to do, is move from crisis to crisis. So I think this will take a burden off the county directors that they don't really want and isn't helping them take care of children by eliminating some of the paperwork burden from them.
Thank you.
Thank you. I don't see any other questions. Thank you so much for bringing that to our attention, too. Appreciate it. Okay, let's take a deep breath now, y'all. Thanks for indulging us and letting us catch up from yesterday. I know everybody's on a very, very tight schedule, but I hope we can all pause and really listen, because there's some very important issues I know that are going to be brought forward today, and I thank you for that. And I cannot think any more appropriate day for us to come together than Valentine's Day, because I know that all of you act out of your hearts all of the time that are in this room, more than dollars can provide. I know that you do that, so thank you. I hope you're having a great Valentine's Day and that it continues. Okay, to begin now, the Department of Veteran Services.
Good afternoon, Madam Chair and members of the subcommittee. I'm Mike Roby, Commissioner of the Veteran Service for Georgia. It's a pleasure and honor to be with you this afternoon. With me, on my right, is Assistant Commissioner Dan Holtz, who is the Assistant Commissioner for our Administration, Health and Memorials. We also have Assistant Commissioner George Canavaggio standing up over here to the left. Mr. Mark Bannister, our Operations Director, and the young lady that keeps us all straight, Miss April Dodgen, who's our budget specialist. Although we brought several slides with us that are in your packet, I plan to only hit on some of the highlights and focus on the 6 slides directly related to the FY 2020 budget. Our presentation is based on page 93 of the FY 20 tracking sheet. When we met just a couple of weeks ago on the amended FY 2019 budget, we discussed the items listed on slides 2 through 4 of this presentation. Thus, I do not intend to address those items at this time. However, we've left those in your packet, so if you want to look at them at a later time. And if you have any questions about any of the information presented, we would be happy to address those questions at the end of our presentation. So with that in mind, let's move to slide number 5. Now to talk about why we were here, which is shown on slides 5 through 10. We started our FY 2019 with a total approved budget of $40,882,769. $23,040,744 of that is state appropriated funds. These funds, funding levels, are the base budget on which the governor's recommendation for the FY 2020 are based. The recommended changes by fiscal program in the department are depicted on slides 6 through 10, along with the recommended total summary for the agency. Slide 6 addresses our administrative physical program. There's an increase to support a merit-based pay adjustment of $31,257 for the personnel working in this area. Please keep in mind the 2% adjustment in this physical program, and likewise the other 3 physical programs, includes salary and fringe benefits. The amount of salaries in this physical program alone equates to approximately $19,000. That is merit-based and focused on recruitment and retention. There is a $9,654 reduction related to the state health benefit plan. There's an increase of $5,276 for DOAS self-insurance premium increases, a $5,229 increase for cyber insurance premium increases, and a $997 increase related to TeamWorks billing. The results in a net increase of $33,105 for the program. Our new total for the FY 2020 in this physical program is $1,923,287 in state and total appropriations. On slide number 7, there's a $13,363 increase to support a merit-based pay adjustment for recruitment retention of the staff of the 2 state veterans cemeteries. The salary portion of that amount is approximately $8,100 for recruitment and retention of 13 employees. There is a $4,127 reduction in the funding for the state health benefit plan, and an increase of $2,256 to support the DOAS self-insurance programs. The recommended adjustment brings the physical program net up by $11,492 for a total in state appropriations of $710,475. Slide 8 depicts the recommended adjustments for the nursing home's physical program. There's an increase of $168,832 for merit-based pay adjustments for the staff of the nursing homes in Augusta, which is operated by the Georgia Department of Veterans Service by the Augusta University Health System. In addition, there's an increase of $13,943 to support the increased employer share of the teacher's health benefit plan related to the Augusta nursing home. The program net increase is $182,775, covering both state war homes, and the total increase in the state of $12,986,348. When federal VA funds and veterans patient daily fees for both homes are added, the total FY 2020 for this physical program rises to $29,272,929. On slide number 9 depicts the recommendations for the Veterans Benefits Physical Program. There's a recommended increase to support a merit-based pay adjustment for this program of $124,132. There is a reduction of $38,341 related to the state health benefit plan, along with an increase of $20,933 to support DOAS self-insurance plans. There is an increase to support establishing a Veterans Field Service Office in Clayton County to support Clayton and Fayette counties for $128,946. Finally, there is a statement of support to use some existing funds amounting to $33,429 as opposed to additional funding to reestablish the annual Veterans Supermarket of Benefits. The total physical net program increase for state appropriations amounts to $235,690, which brings the total state appropriations for this physical program up to $7,883,696. When federal VA funds are added, the total appropriation rises to $8,511 $136. Slide number 10 depicts the total of the recommended adjustments for Georgia Department of Veteran Service at $463,062. And the new total for state appropriations for the agency is $23,050,371, a total funding of $41,345,831. Madam Chair and committee members, slides 11 through 13 depict our mission, our vision, and our values. And we just ask that you look at that, when you have time. And at this time, ma'am, members, we will address any questions that you may have. And we want to thank you for the opportunity to be here today. Any
Thank
questions?
you. Thank you. Great
Thank-
presentation. We'll
Yes,
start.
ma'am.
Representative Henson, I think, had a question.
Thank you.
Yes, ma'am.
Regarding the additional Veterans Field Service office in Clayton County, the $128,000 is just for the physical building, and such, does it include personnel, or what are we looking at?
Yes, ma'am. It includes personnel, ma'am. Yes, ma'am.
So how many?
2 people, ma'am. 2 personnel.
So that's just salary. It's not the physical building.
That's right. It's salary and benefits, ma'am.
Okay, that sounds fine. Do we have?
There's an estimate, ma'am, for the building for rent, etc.
Excuse me?
There will be an estimate for the rent. We won't own the building.
Okay. Is this going anywhere near the Social Security office down in?
We're not sure yet, ma'am.
Okay.
Where in Clayton? We're looking, in Clayton County and in
Okay.
Fayette County, yes, ma'am, at property. We've already coordinated with state properties, and they're on the look.
Okay, thank you.
Yes, ma'am.
So that was 2 employees?
Yes, ma'am.
Salary.
2-person office. Yes, ma'am. That's 2 salaries. Yes, ma'am. And benefits.
Okay. Representative Oliver.
I'm sure that the growth of Clayton County requires, and you're looking at your caseload, where they're coming from. Where do Clayton County veterans go now if they go into an office?
Ma'am, they have the option. They can go down to Miss Karen's district down in Griffin. We have an office out here at Fort McPherson, across the street to where we're located in the building. They
And
can go to Noonan.
You almost always put your employees with some other agency. Is that the plan?
We try, yes, ma'am. We try, yes, ma'am. We've been partnering with Social Security and Department of Labor to go in with them. Yes, ma'am.
Based on your case counts per office, I'm guessing there's a variety of activity. Some are busier than others. Have you ever closed an office based on low activity?
No, ma'am. What we've done, ma'am, is we will look at the caseload, and if we feel once a person departs, we will look at possibly making that what we call an itinerant site. Not actually close it down, but maybe open it 1 day a week, 2 days a week, versus closing it down. Yes, ma'am. Yes, ma'am.
Representative Benton.
Thank you, Madam Chair. I was looking at some of the brochures here on the Georgia War Veterans Home at Milledgeville. What is the capacity of that home?
370, sir.
370.
Yes, sir.
Is it full?
No, sir.
We've got a number of beds down there that are currently under renovation, and we're reconfiguring a number of them. Right now, the total population for both homes is 380.
Okay.
And about 140 of those are in Augusta, and the balance are in Milledgeville at the present
Okay.
time.
All right. So the one at Augusta, is it the older of the two?
No, the one in Milledgeville is the older of the two.
All right.
Augusta was opened in '69, I believe, and the one in Milledgeville was opened in 1955.
Is the Augusta home over there close to the hospital?
Right across the street.
Okay. All right. Thank you.
Okay, are there any other questions? Not seeing any. Thank you. Thank you
Thank
for
you,
your
ma'am.
service, and thank you for being here.
Thank you,
Appreciate
ma'am, for all your support and what you do.
Okay, so now we will hear from DBHDD. Commissioner Fitzgerald.
afternoon, Madam Chair, members of the committee. Appreciate the opportunity to be here with you this afternoon to present the DBHDD FY20 budget to you all. Next slide. What we hope to cover with you this afternoon is just a quick overall budget update, operational summary, and then we'll take a closer look at our agency initiatives and very specifically our budget requests. And to the degree we have time, we always like to have an opportunity to tell you a little bit about what's ahead, some of the challenges and opportunities. But of course, we start, as we always do, with just a note of gratitude. You all have been very supportive of many of the initiatives, knowing that we really, together, all have a shared interest in many of Georgia's most vulnerable citizens. So thank you for the continued partnership and your ongoing challenge to make sure we are meeting the budget intent and the goals that we have together. So just a quick agency status update. These 4 bullets should be familiar to you. Just a reminder of the things that you have supported in the past. And all of this work is underway. You'll hear a little bit more about it in the FY20 budget, but your support around waivers for individuals with intellectual and developmental disabilities has been ongoing and very appreciated. You also have provided extensive support for the building of what we call behavioral health crisis centers. That's our newer model of crisis centers that are located in the community. As we've closed hospitals, we build up those local behavioral health crisis centers. You all have been very supportive in helping us to build those. And as you well know, supported housing for people with serious mental illness is an ongoing challenge and concern. Your support for the voucher program and other services around that help us to really support recovery in the community with housing opportunities. And then finally, support for the Child and Adolescent Mental Health Commission, of course founded by Governor Deal, and the $20 million and all the full complement of services that came along with that. Much of that work is on the ground, and we have appreciated your support in all of that. So the budget requests coming forward launch from there, and I think remain consistent with our agency priorities. Next slide. So as we always do, I just like to remind you with this snapshot of the DBHDD budget, just because it's large and complex, involves state funds and federal funds, and this shows you the breakdown between state and federal, also then between hospital and community, with a little bit of an eye towards administration dollars as well. So just offer that as our FY19 appropriation snapshot. And then next slide, please. You see a trend slide that we'd like to show you. This allows us to tell the story that we've been telling for quite some time, which is we do have our state hospitals. It's critical that quality services continue to be provided in those hospitals, but the investments largely that you have continued to make have really helped the community-based system of care for individuals with behavioral health and developmental disabilities to grow. So that upward trend in the yellow really shows, you can't see the numbers, but you see that upward trend in community spending. And that's purely state appropriations there. So that's where we're going, and now moving forward, our FY20 budget priorities. And I think, just give you an overview, again, I hope some of the themes and the phrases that we're using here are familiar, because we feel like we've been on a transformation path together, talking about ensuring easy access to high quality care. And that has involved some very specific services, crisis services, and that's really in mental health and DD, IDD waivers that allow individuals to live successfully and thrive in the community. Also, you're going to hear this afternoon a little bit about residential beds for addictive disease, which is a really critical addition to our budget. Our administrative services organization, talked to you all a little bit about that last time. That's kind of our infrastructure engine that allows the machine of healthcare to operate in the modern environment. And then we have some hospital services as well. Those are really all the things that help us move towards easy access to high quality care. And then you see the other priorities there. Mental health, supported housing for people with serious and persistent mental illness remains a top priority. We'll talk a little bit about forensic services today as well, and the continuum that we are trying to build there. for individuals that are involved with court systems. And then I mentioned this in our amended budget meeting, talking about core services for the first time, and that's really our basic outpatient services. And be happy to talk a little bit more about that, because that's really an exciting addition to moving our budget forward. So with that, we'll step into the budget changes for 2020. Just to let you know, we're following on your tracking sheets. I believe we're pages 18 to 21. We've just got a few. We tried to simplify and package things together, I hope, in a way that makes sense. So our slides are different from that, but you've got page 18 to 21 for us. So I'll go through these. This first slide are really sort of the administrative, the agency budget requests that are statewide changes, budget adjustments that you see across multiple agencies. With your permission, I won't spend too much time with that. I think many of those are familiar to you and seen across agencies. So I'd like to move to the next slide, where we begin to talk about the annualization of 19 funds and talk a little bit about each of the items here. So the first item is the Behavioral Health Crisis Center funding, and you see an amount there, a little over $8 million. If you remember, our behavioral health crisis centers are our more modern crisis center facility in the community. These are larger than what originally we had crisis stabilization units all around the state. And what we found, there was a need for a more enhanced and expansive model. And so we have continued to build those throughout the years. And currently the FY19 annualization, we are building a behavioral health crisis center with Avita, which is in Gainesville. In addition, if you remember, those cost around $7 million, so the additional funds in there are to assist up in the area of Highland Rivers, which is Region 1, essentially the northwest corner of the state. Highland Rivers has been very successful in running crisis beds up in their region of the state. In fact, they've got 72 beds, so they didn't necessarily need a new bricks and mortar facility. What we need to do is some strategic and targeted enhancements, adding temporary observation beds. They're also doing some really innovative pilot work of going into the emergency departments up there in the local hospitals and partnering right there to serve people where they're showing up, which is in emergency departments. So that's the additional funds there, and you're annualizing the FY19 investment. The next item, again, is annualization of the FY19 125 DD now and comp waivers. You all have become, I think, used to seeing this. In each one of our budgets, you've continued to make a commitment for waivers that either move people off of the planning list or from hospitals into the community. So this is the annualization, again, of the FY19 funds there. And then the next item, the final one from FY19, is the annualization of one of the items from the Child and Adolescent Mental Health Commission, which was specifically targeting supported employment for 500 youth and young adults. And so this is the annualization of that first item that came out from the commission funds. The final two items on this slide are actually annualizations of the amended budget. So these are the ones that I talked to you at length about in the last budget presentation. The Medicaid loss offset, and you see a $7 million item there. Just a reminder, that helps to really offset when individuals with intellectual and developmental disabilities leave the hospital and go to the community. This is what we want to have happen. But we do have a reduction in Medicaid revenue in the hospital. So this really, and as you would imagine, we still have fixed costs in the hospital. So this helps to really make sure that we keep quality of care in the hospital while still doing what we want to do, which is moving individuals from the hospital into the community. So that's an offset there. And then the amended, the annualization of the amended funds around the Administrative Services Organization. Again, you'll remember that's sort of our infrastructure engine that really helps to oversee quality utilization management, and it is the backbone of administering all the services and care that is delivered thousands of units of service that gets delivered week after week, month after month. This is the mechanism by which we track. Also, the Georgia Crisis and Access Line is part of the Administrative Services Organization, and that's really the backbone of DBHDD's administration of the services that we have. So all of those are annualizations. Let me move to the next slide, and we'll talk about priorities for fiscal year 2020. And we put these 3 items on a single slide so we can talk just for a minute about forensic services. So we have 3 line items here, and they're really representative of what DBHDD is trying to do, which is to really have a continuum of care for individuals that require forensic services. Just a reminder, forensic means that these are individuals that are involved with the court system. So DBHDD's role and involvement with them is these individuals might need a number of things. They might need inpatient treatment in our hospital system, or they might need an evaluation of their competency before they can stand trial. We also have personnel that do that. You also see a forensic community integration home. When an individual is ready to leave the hospital, but the court would still like them under supervision of DBHDD personnel, we actually have 24/7 staffed homes that allow those individuals to step down out of the hospital and into community-based settings that are staffed and supervised so that individuals can move towards living in the community at the appropriate level under the appropriate supervision. So you see the items there. We are trying to make sure that forensic services, and this is a growing need in Georgia and every state. So it's it's a challenge when individuals get stuck in one part of our system, whether it's in a jail or whether it's in our hospital. So the funds here, the positions for the coordinator and the evaluator, are so that we can move more swiftly to identify what people need, assess what they need, and move them to the proper level of care. So you see that really it's that full continuum from hospital to doing work in the community and overseeing folks that are in the community that the court would like ongoing supervision for. So we have those 3 items there totaling $1.8 million. In addition, one other part of our continuum there that I do want to mention because y'all have been supportive, we actually are building a new 40-bed unit, which actually is going to be at our hospital in Columbus. Originally it was going to be in Atlanta, but that for many reasons became logistically not possible. So a new 40-bed inpatient unit, and this is another really critical part of the continuum. We're just beginning the building around that unit now. That's going to be another really important. If you think about how do people move through a continuum, you just have to have access across all points of the continuum. So you've already supported the building of that, so construction is underway. Next slide. Okay, so here we get into some other DBHDD priorities. Again, some of these will be familiar to you, the first 2 in particular. As I mentioned, you've been very used to us over the course of time, continuing to request waivers each year. And so here you see 125 new and comp waivers now for fiscal year 2020, right? We still want to keep moving people from the planning list. We still have individuals that are in the hospital. We want to keep moving that forward. And the second one, the mental health supportive housing vouchers. Again, people need a place to live while they work towards their recovery. The housing voucher, the Georgia Housing Voucher Program, which has been acknowledged really as a premier program in the country, these vouchers would allow for 700 new individuals to come into the program. Those 2 items, they are familiar to you, I think, because you are familiar with us talking about them in the context of the ADA settlement with the Department of Justice. I just want to mention, they're the right thing to do. This is the work we want to do. We're not doing this because the Department of Justice says that this is what needs to be done. Helping people to live successfully in the community is the work that we're trying to do. So those 2 items I think are familiar to you, but they continue to advance this momentum of helping people to thrive in the community. The next 3 items, I'll talk a little bit more because some of these are a little bit more are newer in our budget priorities. The first one, crisis bed infrastructure. I imagine this won't be a surprise to you because we hear, as you all hear, we need more crisis beds. So you see currently there are 21 behavioral health crisis centers. Those are the expanded and enhanced crisis centers where you can drop folks off, and we have more capacity in those to serve. I'm sorry, we have 21, that's a total of 11 BHCCs, our behavioral health crisis centers, and crisis stabilization units. The funds we're seeking here, the infrastructure fund, there are many places in our crisis stabilization units in particular, but across the board, where the facilities are older and the acuity of the individuals that they're seeing. We need additional staffing, possibly security, and adjustments to facilities in order to make the ones that we have more functional for the population that we are seeing in communities across the state. So it's not always just about building new ones. We do want to keep doing that, but it's really about seeing what we have, enhancing what we have, and that would be infrastructure investments across the entirety of the crisis network, which it really is sorely needed, especially in some of our older units that have been around for quite some time. So you see that's a $10.2 million request there. The addictive disease residential beds. This is a really exciting addition. Currently, there are 176 addictive disease residential beds around the state. This addition of 144 would essentially amount to 6 new facilities with 24 beds each. This is so critical. Y'all are very familiar with the opioid epidemic and the growing awareness that addictive disease really is a major challenge for Georgia and every other state. One of the other things we found is there are times where our crisis units are full, and they are full with people who are detoxing from an overdose of some kind. And in fact, they stay in those beds longer and they take up beds. So sometimes it isn't just build more crisis beds. The addictive disease residential beds really help solve the issue that the person may be dealing with. So this is a nice infusion of really some important services that have been lacking in the state. So you see that's about a $4.9 million request. And then the final one, we're certainly pleased to be able to make a request to you for core behavioral health services in around $10.5 million. So for many years, we have all been in this together saying we've got to meet those crisis needs. It's so important. We're going to keep needing to meet those crisis needs, but you know what the challenge is. If you build it, they will come, and we have built a lot of crisis services. And many of you have asked, members of the General Assembly have said, wait, isn't there more we could do so we're avoiding crisis? I think Jeff Miner, our COO, has a great way of saying we've built a whole bunch of emergency departments for behavioral health, and we haven't built basic outpatient. We really need to enhance easy access at an outpatient level across the state. So this first $10.5 million would be a start to really make it easier to get access in your local community. So we're really pleased to be building not just the crisis end, but the whole continuum of services. What we estimate that would allow us to provide outpatient basic services to over 8,500 individuals in Georgia. That really matters. That can make a meaningful difference in places where folks are saying, I can't get what I need as quickly as I'd like to. So you see the total there around our budget priorities in $32.4 million. Next. Okay, and thanks. Next slide is really just looking ahead to tomorrow. Some of them feel like today, but I guess we'll say they're tomorrow. And just to give you a snapshot of what's ahead, some of it is things you're already recognizing and making investments in this core outpatient funding. That's really going to be the answer to how do we do more before people get to crisis. Continuing to expand supported housing for people with serious mental illness, that's going to be an ongoing need. Affordable housing is a challenge, but those vouchers are really, really an incredible tool in helping us to counteract that. We want to continue to enhance our crisis services. That's not going to end, so we want to do both ends of the continuum. And of course, I do want to mention, you all had asked us to look ahead and what would it take to address the needs of individuals on the DD planning list. And so you have a report from us about that, about a way that if we decided, we really could make a long-term investment to really bring down the number of individuals on the planning list and get those folks into community services. The last item on this slide, of course, it's critical to be able to talk about provider rates. We can't demand providers provide quality services without ensuring that they can have the rates in order to provide at a level that's commensurate with other healthcare services in the state. So we'll continue to be hand in hand with the provider community to talk about rates. Final slide? Great. Again, I think everyone's aware of the need to address addictive disease issues more aggressively. The great thing is DDHDD serves as the state authority for behavioral health issues. There will be more money from the federal government coming down the pipe to address the opioid epidemic. We anticipate the next round of funding, Georgia will receive $20 million. DBHDD's job, now you know those $20 million from the feds come with a lot of strings attached, but that really is about prevention and it's about treatment in the community. And we'll be excited. Our job is to turn that around, to make education available, but really to get treatment in local communities all around the state. We will continue to talk to you about forensic services. As I mentioned, and it's important to note, many states are challenged by the growing population of forensic individuals, and this is both a community challenge and a hospital challenge. We also have individuals that are with us permanently in our DBHDD hospital setting, and you won't be surprised to hear they're aging, and their needs change as they get older in our hospitals, and this has become quite a challenge as we face that some of those folks need nursing home level of care that we're not quite equipped to deliver in our hospital setting. And then finally, I sort of save it for last because in a way it's more critical than anything else, which is all across the mental health, substance abuse, and intellectual and developmental disabilities workforce, we have shortages and we have challenges. And as a state, I know you all are as concerned as we are about we cannot deliver quality care without the workforce to do it. So that's really a challenge that we're going to have to be talking about assertively, I think, in the time ahead. So that's a whirlwind approach to DBHDD's budget. And I thought you might have some questions, so I wanted to make sure we had time for that.
Very good. Thank you. Thank you for that. We do have some questions coming, so we'll start first of all with Chairman Benton.
Thank you, Madam Chair. Commissioner, thank you for coming today. I've got several questions in a range of areas, but I'd like to start with the tracking sheet, line item 1547, where we are looking at the cost of behavioral health crisis centers in the areas with the greatest need.
Mm-hmm.
Where are those areas?
Okay, so you heard that the first one was Gainesville, right? That's where the current the HCC was being built. The second area you heard a little bit is Northwest Georgia. Highland Rivers is our community service board up there. And, you know, I mentioned, I hope that makes sense, because really when we closed the Rome Hospital, we didn't build up community services. So we're catching up there. And then probably the next item on the list is the Metro Atlanta area, probably really specifically Fulton County. Those are really the top three areas. And we have some forecasting tools that allow us to really continue to predict where people are going for services, where the gaps are.
Okay, all right. On line item 1511-1, where we're transferring funds, could you give us an update on the state's prevention efforts?
Yes, so we didn't put the transfer slide on here, so just to be clear, that I think the transfer item that you're looking at.
Yes, transfer funds from the Child and Adolescent Addictive Disease Services Program.
Yeah, okay. And so this is a little bit of just an administrative shift for us. The money went into our addictive diseases office. And that's the office that oversees treatment for addictive disease. The money was intended for prevention, so we moved the money to prevention services. So there's no change. It's an administrative change for us to make sure we're calculating that money for prevention goes into prevention, money for treatment stays in treatment.
All right. If I could ask a couple more, Madam Chair. On the slide for the forensic,
Yes.
you have down here 1, 2, 3, and you've got forensic coordinated positions, 8 total, and you've got 627,344. That averages out to 78,000, roughly $78,500. Is that? Do we already have the place for them to be? Is that going to be their salary? Is that going to? Is that counting insurance and all of that?
I'm going to double check with my team. Yes, that's
right.
total cost, salary and fringe.
But the total
benefits.
package for each person was roughly $78,000, correct?
Correct? Yes. Yes.
So if we move down to number 2, the evaluators, there is $156,000. What is the difference? Is there a difference in degree? Is there a difference in
Yes.
schooling? And
Yeah, so the forensic evaluations are conducted largely by licensed psychologists who are specially trained in this
do
area.
they work for the state, or do we contract with them?
They work for us.
Okay.
Yeah.
And
They're hard to find with.
And the third thing, the beds, 6 beds,
Yes.
average out to about 72,000. Did you say that was a full time? In other words, is that 24 hours?
Yes.
All right. And I got 2 more, Madam Chair, and then
Okay.
I'll be done. She'll be glad I hush
Be great.
up. On the slide with the state fund changes, budget priorities, number 1, 125 new non-comp waivers. Can you tell me how many of each?
So team is making sure I'm right here. 75 comp, 50 now. 50 now.
Okay, how many?
75 comp and 50 now. 50. I'm sorry, 50. Yeah. 75 of the comp waivers, the more comprehensive, and 50 of the now.
Is when we do that, is that because the comp is the more expensive? It would seem to me that you get more bang for the buck if you go with the cheaper ones, that you get more people off the list. Is there a reason?
Yes, there is, because we really, the list is organized by needs, and there are some individuals, I might have shared an example case like this before, maybe an individual who's on the planning list for comp lives at home with a single elderly parent, and that parent dies, right? Then that person literally zooms up. We have an immediate need for that comp, and they have the highest level of need. So.
Of course, I understand why you do it, but I've always thought that was kind of unfair. You got somebody that's been on the list for 5 years, and they're first on the list, and all of a sudden you got 1 or 2 people supersede them, and
Yeah.
and so. Okay, one last question: how many total people are on the list now and comp waivers combined?
It's just about 6,000. I mean, it sort of changes every day. Yes. Yeah. Okay. Yeah. Which
Okay.
is so. If you recall, a year before we did the report for you all, it was up around 8,000, and we did a really extensive effort to clean the list, make sure it's accurate, so that when we're telling you what the ongoing need is, it's current and it's up to date. So we believe that it is at this point.
All right, thank you.
Oh, can I add one more thing? Folks on the planning list are able to access some services, so they don't just sit in waiting. We do have some family support dollars that you all, again, provide in the budget, so that there are certain items before they are able to actually receive the waiver that we can do an awful lot to help families and those individuals along the way. The planning list is painful, but we do everything we can to reach out and have something available.
Great. Okay, Representative Oliver.
I'm overlapping a little with Chairman Benton's question. Where are the 176 existing addiction beds, and where are the 144 new beds going?
So I don't have that. We absolutely can get you that information. All around, though, yeah. In every region.
And the 144 will go, and you can email me that
Yeah.
later.
I'd be happy to.
Last year, and forgive me if I'm not remembering this correctly. Last year you told me y'all were going to do a reorganization of the NOW and COMP, and you were possibly considering doing some new designations. And you also told me that there, of the 9,000 last year, that there were about 2,800 or so that were true high priority. Am I remembering any of that correctly?
You're close, I think. So again, what we did a really massive cleanup of the list. So it was up over 8,000 at that time. We've now, some people moved out of the state or for other reasons, needs changed, all of that. So now it's back down to 6,000. I think the way we've got it, there are about 1,000 on the comp waiting list. Am I correct, Mary? And then, which would be the more intense needs.
So the
and then
2,000
about-
of last year went down to about 1,000.
Yeah, some of which, again, some people have moved on to waivers in the
Or
community.
died, or
The list is fluid. Yeah.
the list is fluid.
Yes.
And when I'm told that other states have, quote, no waiting list, your response, and this sounded, I just need to follow up and understand that. You said the other states really just didn't define need the way we do, that we're more open about need. Is that an accurate assessment?
So I think I certainly want to be careful in what I say here. There is a way to have no planning list, and which is to put the eligibility up so high that the limited number, and you say we're only going to have 10 new waivers a year, and so you don't keep a planning list of many thousands because your eligibility is at the highest level of need. I think that while the planning list is a painful thing, the reality is we're trying to say you will be eligible as the funds become available.
Is it accurate to say that some people on the 6,000 list will never be served?
Again, what we know is that they are receiving, and there is the capacity to receive some services. And our 5-year plan talked about a way that if the state had a willingness to really make a big investment over the course of time, we're doing things on the administrative end to move that along faster. This would be a big investment, but a real statement by the state of Georgia.
Thank you.
Okay, there's Make Yet.
Thank you, Madam Chair. Back to the page that Chairman Benton was on. On the 144 AD residential beds,
Yes.
what's the current capacity? And can you help me with that a little bit?
So the 144 beds is the current. We're going to add 176.
Okay.
I'm sorry, the reverse. 176 is current, 144
We're adding the
is
144.
adding, yeah, with 6 24-bed facilities.
Okay.
And again, we'll share with you current locations and future plans.
Okay.
Yeah.
Yes, we have. We're trying to get that in our heads correctly.
Okay.
Um,
I'm sorry.
Also, let's go back to those. Can you give me a little criteria for the comp waivers? Because those are very expensive.
Yes. Yeah.
So
yeah.
I understand that the level of care is higher, but can you just give me a little criteria of what that really means?
Yeah, so the level of need would be very high. Again, the amount that the waiver is worth is completely dictated by an individualized service plan and assessment of that individual's needs. So in order to be eligible for an intellectual and developmental disability waiver, you have to be evaluated, right, with a cognitive or developmental disability that you've had prior to the being 18. Many of these folks are non-ambulatory and need many assistive or other kinds of devices in order for them to live successfully in the community. And we have so many positive stories of folks that are doing that. But you're correct. It's a great investment for folks to have a life in the community.
And that's for a lifetime, really.
Every year you're evaluated for need, but the folks that really are at that level of need, these are chronic conditions.
Great. Are there any other questions from the committee? Okay, so you've had a big, exciting day today.
I had an
Last
exciting
year-
day with you, Madam Chair.
It's an exciting day for me. I'll say that. I hope it was for you. Last year, those of you that served on the committee may remember that we were able to find some funding to add an app for suicide and certainly for mental health issues, particularly focused on young people. Today, about midday, Governor Kemp did a press release on it. Very exciting, and I'd love for you to tell everybody a little bit about it because it is the fruit of the work that we did last year.
It is, and it's the fruit of your leadership, Madam Chair. I really have to say, I mean, we worked so hard. So, as I mentioned, GCAL, Georgia Crisis and Access Line, and they're a part of our ASO. They've been in operation in the state since 2006. They are our 24/7 lifeline call. I mean, they've been operational. We keep trying to get the word out about the number. What we reported in the press conference this morning, GCAL receives almost 1,000 calls a day. And then sends, when needed, sends urgent response out, or sends in the form of mobile crisis, or they're also connecting people to routine appointments. What they find over the course of time, though, is, and you all see this if you know teens, kids, they don't call, they don't want to pick up the phone, they want to text. And so GCAL, in their wisdom of seeing that, really well over a year ago, started to think about what would it take to have texting capacity out of that framework. And they actually have gotten accredited because they have licensed clinicians that answer the call 24 hours a day, 365 days a year. So today what we released is the MyGCAL app. And the teens know how to do this. You download an app. When the app pops up, it says, do you want to chat, or do you want to call, or do you want to text? And they they get access immediately to a person who's licensed and trained to talk with them over text. They just want to talk. If they want to talk about themselves, or if they see a friend in need, it's all of that. It really, and I just have to say, Governor Kemp was so excited about the innovation, and he and the First Lady, as parents of teenagers, were like, wow, this really is the next wave of how we need to learn how to do services for the next generation. So it was a really, really positive day. Thank you for your leadership. And I want to thank Leo, too.
Yeah,
He just really helped all along the way to make this possible.
He did, and Leo and Michael were both able to be in there in the audience and kind of see it happen because they, as we know, are the ones who actually do all the searching and digging and hunting, finding money for those little ideas that we come forward with at times. So it was good. Just to refresh everybody, GCAL stands for
Georgia Crisis and Access Line. If you don't know it already, the phone number that us old folks could call is 1-800-715-4225. Because today we really focused on adolescents and being able to text, but we really wanted to send the message anybody can call. And you can call just if you want to know what's available in your area or if there's a crisis, but any age, anybody can call. And now you can text and chat too.
Well, and adolescents are connected to families, so often there's a whole family crisis going on, so it's really good. Representative Mathiak.
I forgot to ask you about the community settings, and what do you see the needs there and the growth there? Can you speak to that a little bit?
In mental health or in intellectual and developmental disabilities?
With the DOJ settlements? And
The supported housing?
Yes.
Yes, yeah. So our voucher program, and again, this has been recognized even by the independent reviewer in the case. So the voucher essentially allows a person to rent a living space. They get to, part of this is about being independent, right? And they can have a lease for an apartment. What we do now also is make sure that along with that housing voucher comes, you have to agree that you're going to receive ongoing case management checks from us so that we can make sure folks aren't just isolated out there. We know these are high-risk folks with serious mental illness, and we connect them to ongoing case management services, hopefully leading them into treatment and recovery. And then for those who are successful, they can move on. People leave the housing voucher program, and we have many success stories where folks have gone on to get a job and be thriving in the community and can lease their own apartment. Yep.
Thank you so much.
Thank you
Appreciate
very
it.
much.
So I got a little question up here about how to download the app, and I have a little. I know I'm not going to make you do that right now.
I wish I brought my kids.
Listen, the gloriousness of all of this is
It's
that
on the Apple Store,
I just
Apple and
texted
Android.
it to
So
Michael, who is going to make sure everybody
we go.
knows how to download it right away. Okay, so we will get that word out to our community.
I
so
see you
can
smirking,
really look
Michael.
at
Yes,
it.
we appreciate it.
Yeah. Thank goodness for young people, right?
Exactly.
Yeah. Well, thank you for. Let me ask you one other thing. So, maybe just a little brief update on the Department of Justice settlement, because I know we always talk
Sure.
about where are we, what's going on, what do we need to be grateful for, and what do we need to be cautious about.
Yeah, thank you so much. Great question. Really want to emphasize the point. So much of the work that we do is not because of the settlement agreement. We're doing a lot of the right work. They happen to put pressure on us, but much of the same work that we're doing is going to continue after we exit the settlement agreement. Where we stand right now, technically and legally, is that before Governor Deal left office, he wrote a letter to the Department of Justice saying, we think the state of Georgia is in substantial compliance, and we would like to sit down and talk with you, Department of Justice. I was right before the shutdown originally, and we have not heard back yet. The good news is you keep funding the work we're doing. The work goes forward, but we are eager, and we hope to have a conversation with the Department of Justice. We would prefer not to be back in court. It is our hope that between a conversation between the parties, the state of Georgia and the Department of Justice, that we really could talk about where we are, the progress and the transformation we've made, and how Georgia can move forward on many of the other priorities you've heard here. Because we've got lots of work to do. The transformation has been dramatic, but there really is still a lot of work ahead.
Well, thank you for that. Thank you. I know we're often reminded in our communities about it, questions that are asked about
Yeah.
why is there not, certain places. I know I hear it a lot in Rome. Y'all all know that I do, but I'm pleased, very pleased personally with the ramp up of services that are there, and grateful that our governor also is seeing, very wisely, I would say, seeing that this is such an important focus and how we can continue to deliver more and more services, and also younger and younger,
Yeah.
to attach those to children as soon as possible. So
Yes.
thank you so much. Seeing no other questions,
Thank you,
can
thank you,
step
Madam Chair.
away
I'd like
and
to.
take a
Thank
deep
you,
breath.
thank you,
You can
Madam
take a
Chair,
real
and,
deep breath
and really
now.
thank you for your ongoing support.
Yeah,
We
and
really
I'll tell
appreciate
you, we
it.
do have a number of people that have signed up to speak this afternoon, and if you didn't sign up and you need to, please let us know. There's still time to do that, and I'm going to do my best to not butcher names, but sometimes that can happen. So I think the first person that is signed up is Courtney Leisner. If you would like to come share with us. And please tell me if I said it wrong. You correct
No,
us.
you had it right. It is Leisner. A lot of times it's Leisner that comes out. But I just want to say good afternoon, Madam Chair and the committee members. Just wanna
We're gonna.
thank you.
Can you pull that closer? I tell
Sure.
you, we're
Is
having a little bit of technical difficulty.
Sure,
There's a little
is-
static, so we're bringing it up and down occasionally. Try to cut down on the static. But
Okay. Does that sound a little bit better?
Better. Yes.
Okay,
thank you.
great. Once again, good afternoon, Madam Chair and the committee, and thank you for letting me speak with you today. My name, you got it right, Courtney Leisner. I'm from Decatur, Georgia, and I'm here today to advocate for my brother Hugh, as well as for caregivers of family members with developmental and intellectual disabilities. I want to talk a little bit about Hugh. I even have a picture here I can pass around. The two of us. He's 34. He's diagnosed with cerebral palsy, epilepsy. He has an intellectual disability and also autistic features. And a little bit about him is he loves things like doing puzzles, though they can't be more than 60 pieces. He loves singing. Some of his favorites are songs from Disney movies, especially The Little Mermaid. He also loves to have his family and friends read to him. Dr. Seuss are some of his favorite books. I think he's even wearing a one fish, two fish, red fish, blue fish shirt in that picture. And he's a real charmer. He loves to tell all the women in his life how gorgeous they are, as long as they tell them he is very handsome. So there's some strings attached. But in addition to all of this, Hugh needs constant supervision. He can't be left alone. He needs help dressing, bathing, grooming. He needs someone to make his meals for him. And he can't be left unattended. He has a tendency to just sort of roam and wander. He doesn't know his way back home, so there are some safety issues there too. Currently, my parents are his caretakers, and when I was 18, I was made his guardian if anything were to ever happen to them. And at the time, that didn't seem like such a big deal, but 20 years later, it's becoming more and more a reality. So realizing my parents' own health issues, they moved from New York to Georgia to be closer to me and my family, as a resource and support for them. To give you a little information about my parents, they are two great people, but they have some of their own health concerns as they're getting older. For example, my mother has had 2 hip replacements. She's currently using a walker for her sciatica. She also has heart disease, and a few years ago had stents put in place in her major arteries. My father he's a 9/11 first responder, a cancer survivor. He also has trouble getting around due to arthritis. So being the responsible and caring parents they are, they wanted to get Hugh set up with services near his sister if anything were to happen to them. I'm sure they also wanted to be near me too. But that's really the heart of the matter. What we didn't realize when they moved from New York to Georgia, and you hit upon this a little bit earlier, is that unlike New York, where all individuals with an intellectual disability get services after they're 18 and age out of the education system, Georgia is not quite like that. There's a very, very long waiting list, and we were really shocked by that. And as you know, currently there are over 6,000 sons, daughters, grandchildren, brothers, sisters, who are all on this waiting list for the now and comp waiver, and Hugh is one of them. And in having these family discussions, you know, my husband and I both work full time. We have 2 young children. And I often go to bed at night worrying about our situation if something were to happen to my parents. How would it impact Hugh, our children, our finances? Would one of us have to quit a job in order to be Hugh's full-time caregiver? Would we be taking care of our aging parents and a sibling with disabilities? How would we manage to survive if we increase the number of people in our household while cutting our annual income in half? Would we need to rely on government support? Additionally, you know, all of these things, when you think about them, they're very emotional, you know. So in addition to that emotional toll of dealing with either loss or grief, you know, dealing with that stress of having to deal with everyday, day-to-day activities with the burden of managing those due to the stress of Hugh's lack of services. You know, those are things we think about and we have conversations about. But most importantly, without services, the threat of not having a caretaker for Hugh means he could be institutionalized. And the thought having any member of your family put in that position is just heartbreaking to me. He means so much to myself and my parents, And we'd never want that to happen to him. So that's sort of why we've kind of made this plan to get services in place for him. Hugh has the right to live in his community without any sort of institutional bias, just like everyone else does. On top of that, while Hugh is waiting on the list for the now waiver, he is decompensating. He's very social, like I told you before. He loves people. He's depressed that he can't be around his peers to interact with. His motor and cognitive skills are slipping. And my parents, who thought they were doing the right thing, feel incredible guilt. Sorry. About lifting him up and bringing him here and taking him away from a day program. And he's sitting here waiting for services. And he needs those services, and so do they. You know, it gives them a break during the day as well, because they do a lot for him and for all of us. But anyway, sorry that I could get through this without some tears here. But I just really wanted to stress the urgency of our situation, and I know there are thousands more families here in Georgia that are going through something very similar. I'm quite frankly just shocked at how little support there is available to us. And I urge you to all support the Georgia Council on Developmental Disabilities request for additional funding to increase the amount of now and comp waivers for Georgia families. And I just also want to thank you for listening to me today. I appreciate it, and I'm happy to answer any questions that you may have.
Representative Mathiak.
Thank you, Courtney, for being here and advocating for not only your brother, but your family.
Yep.
And for 6,000 other people in the state of Georgia. Is Hugh in a day program now, or
No,
is he
he's-
on that list?
He's on the list.
Okay. Okay. That ruins the rest of my questions. Okay, thank you. And how long's he been on the list? Let me ask that.
They moved down about a year and a half and got the process started, so I'd say close to probably a year now.
Close to a year.
Yep.
Okay. Thank you.
Representative Howard.
I think someone, thank you, Madam Chair. I think someone had asked this question somewhere along the way. How much would it cost the state to completely wipe that 6,000 non-comp waivers off a backlog of the waiting list? Has anyone given us any kind of figure on that? I think Representative Benton might have asked that question. Do we have any idea of what it would cost
To,
the state? I'm talking to my
yeah.
colleagues now.
Yeah. I don't have a specific number right now, but we can get that. I know it's a lot. And the challenge on the list has and always will be that people move on and off of the list. So the numbers, it's a list that to ever get to the bottom of it would be very challenging, just because there's a flow to it always. That's not to make an excuse for your situation. That's just sort of dealing with the reality. I see Chairman Benton. I don't know if he's looking for that or doing something else.
Can
You don't
I-
have anything in there I didn't know.
May I
wanted to make
follow
sure.
up, Madam Chair?
We're gonna look while you're. Yes, you certainly may.
The reason I asked, I mean, a story as the young lady, as you have presented to us, you know, I think each and every one of our members here and even on the floor, I think our hearts do go deep into what can we do to fix this. And sometimes things that we want to do, we can't do because the resources are not there. But I just wanted to make that comment because it's a touching story, and I'm sure there are many others as you speak, that you're speaking not only for yourself, you're speaking for those other 6,000 that are on that list as well. And we've heard that story from folk like Hannah and others. So thank you for bringing that to our attention again.
Sure.
All
Well,
right.
thank you for listening.
Sorry, Representative Donahue.
Let me ask you a question, and please, this is not insensitive. I understand your testimony, but I have to look at all the facts and reasons. This is why I have to ask a question.
Understandable.
Has your family, knowing this, put away money for when they're not there to kind of help with this situation? I have a cousin that's in here that Down syndrome, the sweetest young man you've ever seen.
Mm-hmm.
Wants to be loved, sings, does all types of stuff. His mother, my aunt, just passed away here 2 weeks ago. His father is dialysis 3 days a week. He's 79 years old. He's been pretty successful in his own companies and working, but they've put away money to where as long as they could try to help that situation. And I know 2 or 3 other friends that have the same situation. Jeremy's 48 years old. Another friend, he was predicted to live 13 to 18. Another friend that was predicted to live 18 to 20 years, he's now 51. So these young men, I've seen where 2 of them, they have put money aside for that many years, understanding not to try to depend on the state, but then when they knew the state would have to participate, they had money going toward that. And just asking, have y'all and your family done that?
I think that's a good question. There's a couple of things to that. One, just over the years, my brother has been part of larger communities of, peers with intellectual disabilities. A lot of times, individuals with Down syndrome are a lot more higher functioning. Can go out, have a job, live on their own, things like that. So putting away some money for that need versus 24/7 care are different buckets, I would say. So, for example, if you were not to have a waiver, I think it's, about $18,000, $20,000 to pay for a day program for a year. So I don't think my parents have put away $20,000 for the next, could be 40 years for
Right.
Q a year to sustain the services that he needs. They've definitely saved wisely and done things like that, but to sustain that type of care, I don't think it would be realistic or feasible unless we were all independently wealthy. So I think that's one piece of it that's a little hard. And yes, they've put away some money, but I just don't think it would be something that could cover that. Full-time care would be, around the clock,
Right.
which I think their responsibility was thinking myself and my husband could do that part, but then, we would need something during the day, so we're not, we're able to have those finances and we can take care of him and we can be there in the evenings and the weekends, but families need some sort of respite in the day-to-day to be functioning in the society too.
And I agree, and thank you very much. I just, there's the tough questions that sometimes you have to ask to where people say, well, did you represent all of us?
Yep.
And the testimony I look at is, well, do you have the same experience that I do?
Yep. No,
when we go to family reunions, I enjoy my cousins.
Mm-hmm.
2 of them that one's different day and night as the other one.
Mm-hmm.
One's more sitting down, can carry on a conversation, struggles with different things. The other one very much can't carry on that conversation. Representative Benton's car horn went off, so he left to go turn it off. But thank you very much, and I do mean that. Thank you for. I just wanted to ask that question.
And just one other thing. Something I've thought about in just, having some empathy for other families that are going through this situation. I couldn't even imagine if you were a single parent
Yes.
and you were in this situation, what would you do? I personally don't know, what I would do if I were a single parent having to raise an adult with an intellectual disability and being on that waiting list.
Well, thank you very much.
Thank you.
We have another question for you. If you'll just hang just a minute, Representative Oliver.
Mhm. Mhm. Yeah. Mhm. Yeah. Yeah. Thank you.
So I want to thank you for your courage and for, yeah, for sharing.
Great. Thank you very
Um,
much.
It means a lot to all of us for you to do that. And I want to help you connect. So if you can stick around, or if you want to email me some information about how to get in touch with you, let's see what we can do.
That would be terrific. Thank you very much.
Yeah, thank you. Okay, so we're going to leave the public comment time just a minute and come back. I'm grateful that we've been joined by Rachel Davison from the Office of the Child Advocate, and if you could come share with us a little bit. On the last page of your tracking sheet, members, you will see some information.
Thank you, Madam Chair. And good afternoon. My apologies for coming late. I have juggling meetings today, so
We all are too. I'm sorry. It wasn't
don't doubt
really
it.
Representative Benton's horn, and he's going to get you for that.
I'm so sorry to have missed him. I am the interim director at the Office of the Child Advocate. We are a small state agency with a big responsibility, and so we play a big role in ensuring the safety, well-being, and permanency of children that are involved with child welfare, most specifically the Division of Family and Children Services. But certainly a significant portion of that population is impacted by both behavioral health and developmental disabilities. And wanted to take the opportunity to introduce myself, offer my services, and ask any questions or answer any questions that you all might have for us.
Are there any questions from the committee? Everybody understand what the Child Advocate does? A lot.
Yes, we have a lot of hats, but we are well connected throughout the child welfare community, and kind of try to be a jack of all trades as much as we can be.
Well, I want to thank you for coming over and introducing yourself to us. That was
My
important.
pleasure.
We have some new members as well, and it's just good to have that connection. So keep us informed.
Thank you very much, and I have cards, and I will be happy to distribute before I leave. Thank you.
Thank you so much. Okay, now we will return to someone who I think probably can even answer some of the questions that may have been asked earlier as well. Eric Jacobson with Georgia Council of Developmental Disabilities.
Thank you, Madam Chairman, members of the committee. I will try to answer a couple of questions that did come up in the previous presentation. Commissioner Fitzgerald mentioned in her presentation that the department had created a 5-year plan to address the waiting list. And in that report, they estimated that it would be about $126 million to take 3,500 people off the waiting list. So I guess if you double that, 126 million for 3,500. The numbers that we've been working off of and that were in the report as well were for 600 people to come off the waiting list, it's about $16.3 million. So that's what we've been talking about. And that's actually how they laid it out in their plan they presented to you last year, was 600 for, I think, the coming year, and then 650 or something like that. But it's about $16.3 million for that. In addition, and I'm actually talking about what I was going to talk about, but in addition, when you asked about if families were saving money or putting money aside, you may remember that a couple of years ago you all passed legislation to create the Georgia ABLE program, which is an opportunity for people to save for their disability-related expenses. I think there are about 200 people that have created accounts in the state of Georgia. At this point, we've been working with that commission to try to figure out how to market and do better outreach, because we think those numbers are extremely low, and that families could be saving and putting money aside that will not impact their benefits then in terms of what they receive and what they don't receive from Social Security and the state and Medicaid and those kinds of things. So, so those were two of the questions I heard that came up. Actually, I'm here today because I wanted to talk about the inclusive post-secondary program and our request for additional dollars for that. I know you all had a discussion about this yesterday, and I hope that maybe we can address some of those issues. But just as a reminder, the inclusive post-secondary education program began in 2009 with a $25,000 grant from the council, the Georgia Council on Developmental Disabilities, to Kennesaw State University. They enrolled 2 students. That was in 2009. Today there are 9 programs across the state, and they're serving over 140 students. There are currently 9 programs, as I said, at Kennesaw State, University of Georgia, Georgia Tech, Georgia State, Columbus State, East Georgia State College, Georgia Southern University, Albany Tech College, and the University of West Georgia. Since 2014, you as the legislature have helped build this program across the state. In 2014, you appropriated $100,000, and that amount grew to $500,000. And while originally you gave the Georgia Council on Developmental Disabilities that $100,000, we eventually moved all those funds to GVRA, Georgia Vocational Rehabilitation Agency, and then last year you all decided to give it back to the council. So we have been working diligently with the schools to make sure they get those dollars and that they're doing the things that we're that need to be happening. As I said, we started out with a $25,000 allocation from our federal dollars, and that grew to about $97,000 in 2018. And then also there are other federal dollars that are coming to other partner programs as well. I didn't expect to be back this year asking you for any more funding. However, as part of some of the conversations that took place with Georgia Vocational Rehabilitation, one of the things that they did was they pulled the academic transition teachers out of the classrooms and transferred them internally and assigned them to high schools. And this left the colleges in a bind. They really relied on those teachers as part of each one of their programs. And since they're no longer a part of that, I'm here asking for another $500,000 so that we can at least begin to replace those teachers in the classroom. From the very beginning, this has been a collaborative project, and the collaboration that we've worked most with is the Center for Leadership and Disability at Georgia State University. And I've asked Dan Crimmins, who's their director, to kind of help me with this, to talk about what those academic transition teachers do and how they operate. So I'll turn it over to Dan.
He was, with great respect.
I'm glad my mother was here. Sorry my mother wasn't here to hear that. Good afternoon to the members of the committee, Madam Chairwoman. I really did not prepare remarks for you today. I can talk a little bit based on what Eric had said. I will say I've had the honor to present to this committee 2 times over the last several years on this topic area. And I count the years I've been doing the work in the area of intellectual developmental disability, work with folks with autism, and I coined the phrase about 5 years ago. This is some of the most exciting, groundbreaking paradigm shifting work that I've done, and so I'm very proud of it, although I have lots of people that do the work. My name is Dan Crimmins. I am a professor of public health at Georgia State University. I direct the Center for Leadership and Disability there. We are a federally funded program that has a broad mission to bring, I'll say, best practice to everyday practice, and we try to do that in a lot of different ways. One of our programs is something that is federally funded through the Department of Education. That is the, I'll give you the name and then I'm going to say TIPSID, so I'm going to say TIPSID first, but Transition Programs for Students with Intellectual and Developmental Disabilities. It's $500,000 a year, and we got the initial funding in 2016, and that funding is for a 5-year project. And we have used that money in many ways to incubate programs on the campuses. We helped 2 programs to expand, and of the existing 9 programs, 7 are under the umbrella of our TIPSID grant, having received some amount of funding over the times they've been in existence. Of the TIPSID programs, we had 7 students when we started, and in the last year there's 140 total. The programs at Kennesaw State and Georgia Tech, we work in collaboration with them, in cooperation. I don't have a fiscal relationship with them, so I don't know their data quite as well as the ones that do receive funding from us, where I can say, if you get the money, you got to tell me what you're doing with it and how your students are doing. But we do have a consortium that works in a wonderful collaboration, I think, with our state agencies, with the Georgia Council, with GVRA, to try to say, how do we create sustainable programs that are affordable to all Georgia youth or young adults who would like to take advantage of this? How do we support programs across every region of the state? We're getting closer. And how do we remove the barriers that might be those financial barriers? And part of that has been a partnership with GVRA. So I do want to acknowledge that has been part of the sustainability plan. The specific position that Eric made reference to was I'm sorry, I'm getting this popping here. I apologize for that. Maybe I'll just go a little off center and that'll help. The academic transition teachers. So I wanted the programs themselves, so just a little bit of background. Students with intellectual and developmental disabilities would not typically, I'm going to say, I'm at Georgia State, so I'll put my own institution on the spot. They wouldn't make the admissions criteria for my university. Before I have been to this committee, and I've said, and how much of the university, perhaps many of you have had a university experience, how much did you learn in the classroom? How much did you learn in the dining hall or the rec center or on the playing fields or, sort of in the dormitory? And I would argue that much of what you learned was not in the formal classes, but in those informal places. So that's part one. So we want that, why should students with intellectual disabilities not have access to this environment where they can learn? Part two, and this comes with our federal funding, is that very specifically they said, we want, if we the feds put money in this under the Higher Education Act, we want these students to end up with jobs. So part of your focus has to be internship experiences, immersion experiences, shadowing experiences, support in paid jobs, transition to paid jobs, so that at the end of a 2 or 4 year program of study, that you will go on and enter the world of work. The third part of them is, though, but they are students, and they are expected to participate in the academic content of the university. They're supposed to go, half their time is supposed to be, half of their formal credit-bearing time is supposed to be in classes with students who do not have disabilities. So, the representative mentioned a cousin with Down syndrome, and that student might be expected to be in the poetry class. How does that student deal with poetry class? That student might, the professors will say that student shows up on time, probably has done the reading ahead of time, but may have required some level of work to either dictate a response to this poem that they read, or they may have needed some support to write a poem for this, or I mean, that, assuming that the person wants to take poetry, that but how that this is not something that I'm a university professor. I'm not going to do this. Thank you very much. If I have the students, that's not going to be my job. But how do we? So the academic transition teachers were a position that helped to help me as the professor to understand what the needs of the student were. Helped me as the professor to say, I don't need that to be in writing, but I would like to have an, I'm going to date myself, I'm going to say tape. I'd like to have an audio tape of this. I'd like to have this in an alternative form that says to me that the student did participate in this process and essentially grappled with this content in their way, whether that is an art class, a music class, a poetry class, a chemistry class, a biology class. It is really, those classes are selected in part based on where the students' career goals, where their dreams would take them. So a couple of just a little things, and then I'm happy to try to answer some of your questions. That I heard, I did hear a little bit that questions were raised yesterday, a little bit about sort of, so who were the students? In general, in Georgia, virtually all of our students are post the school system. They are, in general, if they are younger than age 21, they've exited the school system voluntarily. Before that, and these would be students who would otherwise qualify for educational services under the Individuals with Disabilities Education Act. So they would be, for our programs, they can't be admitted to their programs if they haven't had an IEP. So that they have to have had special education services in the school. So our students are generally enter the programs between 21 and 23, 24. Sometimes they don't, many families don't know it's an option for their young adult. The second, the programs are structured in different ways. Some are 2 years and out experience. Some are a 2+2 experience, so that it's a 4-year, they're structured as a 4-year experience. Georgia Southern actually structured theirs as the second 2 years to be fed by other programs, and then now they're backing up to say, well, maybe we want a first 2 years. So the we at the so I support the consortium, and it's working with each of the individual campuses. But by itself, we don't dictate to the campuses what they do, but we do, as a condition of the federal funding, say they must seek a certification from the U.S. Department of Education that they are a comprehensive transition program. And so that is and that requires that people work toward employment, that they have a person-centered plan, that they participate in the general academic climate of the university and in those classes. So the academic transition teachers, just going back. So we will at some point, one of the concerns about the academic transition teachers when they were available through GVRA is that we had 7 positions at one time assigned to 6 programs when 8 programs were running. So one of the things, it may have actually been 5 programs, but when 8 programs were operational. So there was not equal access to those positions. There were a limited number of positions. They had, clearly a person can only be in one place at one time. They were assigned to a campus, and at a certain point, it ran out. Should the funding go to the Georgia Council, what I can say is that we worked in collaboration with the council to come up with a funding formula to the programs based on the size of the program and the need, and I would see that we would do something else, that the funding would be designated for the programs to access to fulfill the function that is an academic transition teacher. We have a job description for that and sort of what that would be, but in basically it is for that person to be, for each of the individuals to be sort of fully engaged in the academic climate of the university, while a different person is helping them on the employment side, and generally the program structure peer mentoring relationships for folks to be engaged on the social side. So we see it as sort of this 3-legged stool that is the involvement in the world of the university. that's my thumbnail. I'm happy to either answer questions or I said to Michael earlier that I know that I tend to be at the 30,000 foot level. I think I have enough to get down to the 10,000 foot level. If there may be some questions that you would have that would require me to go deeper than that or lower to the ground than that I'd have to get back to you. But I'm reasonably confident that not only do I have a picture of what we're doing in Georgia, but this is a phenomenon across the United States, about 250 programs across the United States. We do have 9 of them here in Georgia. And Georgia is seen as having wrestled with many of these issues of widespread implementation in a way that I'm very proud of this program.
Okay. Are there any questions from the committee? Okay, well, I'll ask, and maybe it'll plant a few things for others to start thinking about as well. So I know that you're part of the university system. Eric has wide experience. I want to ask you if y'all have heard of any of the other places, other states that might be doing some technical school programs, some success there.
Mm-hmm. So one of our programs is in the technical is at Albany Technical College, and it's been very interesting. And they operate in some ways in a very different way than all of the other programs. They have an advantage in some ways, given what we do, of having students enroll in credentialing programs that the technical school naturally operates and or regularly operates, and they complete those credentials. The 4-year schools are less likely to have those same credentials. We have had discussions with the Technical College of Georgia. We have an inquiry from at least one more technical school to see what can we do over the next couple of years. And I don't mind saying that should there be another round of this funding from 2021 to, I'm getting too old for this. But should there be another round of funding, what we had talked about is this model that we've used to essentially to use the federal funding to incubate in the 4-year schools. We would look to around the federal funding to incubate in the technical colleges. The state of Massachusetts has most of their programs in 2-year colleges, but those colleges are often not technical colleges. They are more of the traditional 2-year locally based colleges. But we see that as a natural evolution of this.
Good. Well, please keep thinking that way. We need you to do that. We have another question here. Representative Donahue.
Let me ask you a couple here. Y'all do scholarships, okay? Right? With that, are there any privately funded scholarships? Not always state? And is there an opportunity, to intrigue another thought process, CASA just had lunch with some great people. Deal with them all the time. They raise a lot of funding, and then they're matched also. Is that something that you do or could do, or a possibility, or?
That is something so this is where we go to what happens at the local level.
Yes.
Some of the individual schools have done philanthropic fundraising. I know Georgia Southern has done that
Yes,
to
sir.
some degree. I know Georgia Tech has done that to some degree. I believe University of Georgia has done that to some degree. This is where I will say we are we're certainly open to that. There's been discussion about how do we talk about the sort of the what might the availability be for students with intellectual and developmental disabilities to participate in college in the way that their brothers and sisters do with other kinds of scholarship funds, whether they be state or private. I'll say, Representative, we're certainly open to that. I'm trained as a psychologist. Some of this is outside my game, but yes. But I am actually, I understand we have to run these within any given university. I tell people that unless you're ready to run this as a business inside your university, not that it's a for-profit business, but it has to cover its costs and its expenses. The universities are not they don't subsidize any new program like
Right.
this.
And I understand that, and the problem is we have a broken system. With that broken system, it's always more and more and more and more. And as a businessman, I had the privilege to donate or to give, and what I want to do is see a future growth in incentives to where if a business is allowed to donate, let's say Coca-Cola, okay, or Pepsi that was just down here for the Super Bowl, if they say we're going to donate X amount of dollars toward the whole college system that participates in this, and they get a tax exemption from that, then what happens, that to me is a smart way of getting the money you need privately. I had a certain budget in 3 companies that I allowed to spend on stuff like this, or schools and funding. When that budget was met, I was done. But that was a process that I enjoyed giving back, and I'm just trying to look at it. Like when I ask these questions, I'm just trying to see what can we do further down the road, because this is going to keep coming and coming. I want to try to help ideas of prevent it.
As Dan said before, we have had discussions over the last 2 years about how do you build up that scholarship process with private dollars, with donations. Actually, I think Leo and I had that conversation a couple years ago, and I've had it with this on the Senate side as well. The issue becomes, how do we, I mean, we're a state agency, he's a part of the university system, it's creating the foundation system that allows that to happen, and then going out and really kind of marketing it as a part of trying to get a base in that foundation that you could then pay off in scholarships, right? You probably need a couple $1 million just to kind of get it set up, and then use the interest on that to pay for scholarships. So the questions have been asked, and conversations have been had. It's a matter of how do we go to the next step.
And if I might also add, though, the other reason for this position is, I don't mind saying that several years ago when we entered into the agreements that with GVRA that they thought that this might happen, it offered a promise of stability to the program, that when those positions disappeared, it was destabilizing to the program. So I'm going to say you're going to be much more willing to give your scholarship money to the program that you know is still going to be there in 5 years or 10 years. So we're trying to build that base.
Yes.
And I totally agree with you. We have let's say sister programs across the country that that are more mature than our programs, that may have been in existence 5 years or 10 years, that'll essentially they'll look to 10 to 15% of their base being philanthropic dollars, and that's probably a healthy place to be. But I think I'm going to say so many of our programs are still fledgling. Some of the data that get asked for are where are your graduates, and I'm going to say most of our graduates are still in the programs, but
Right.
but we're getting there. We're getting there. We're up to 15, and come May, we're going to add another close to 30. So should I have the honor to be here again in a year, I will be able to tell you a lot more about our graduates than I can now. But I can make the plug, because we put out a request to some of our members to say, tell me, I think it must be the question came up yesterday, are people getting jobs that they couldn't have gotten without the college experience? And the answer from the programs is absolutely yes. They're getting a credential that's recognized as a certified assistant nurse, and a person's doing phlebotomy work. A person is working in a daycare center, but as a co-teacher, not as the paraprofessional. A person is working at UPS in package handling, but it's a $15 an hour job. So that we've got, I mean, I think that these are folks that prior to going to their colleges were sitting at home.
Right.
And now they're working 30 or 40 hours a week, and not just at minimum wage jobs. So, and their prior experiences with being offered an enticement into the employment world was to say, come do this job, that the person said, I don't want that job. And so it is, how do we find the job that people want? Well, work is supposed to still be work, but work should be, but how do we have a job where you are working in an environment doing something that you enjoy doing with people you enjoy doing it, that pays you?
And thank you, and Madam Chair, thank you. I look at situations where, I meet with Ring, and we'll see that job opportunities of employing certain young people. And there's a certain young man that has Down syndrome or Asperger's type that is brilliant. So every time I see him, he comes up, he's right in my face and loves me, tells me he loves me. But he is challenging me to what I should do here at state government with the Constitution. He's challenged me with everything, and I love talking to him. But then he turned to the boss and said, and 15 isn't enough. I do more work than the others. I want 20. I like this guy. He understands negotiation, and that's the way it should be. But I do appreciate, and I want you to know the questions that I asked there. I've always learned if you're successful in something, you want to give back. And there are parameters that we need to learn in this state. And, it's amazing of all the meetings and stuff with CASA. I look at it, and here's a piece of paper, how much they raise, and then we help. And I want to see eventually get to that program to where this chair, Madam Chair, has done an outstanding job for several years. And I'm privileged to be here, but I want to ask the right questions. I want to see us going down the path to where we start fixing problems.
So let me just say two quick things to that. The first is that I guess I have to say three things. The first would be that I echo what you said about appreciation of Madam Chairwoman here, because she has been a champion for this cause in this state and has really helped us, I think, to put ourselves on a national map this way. The second thing that I can say in good conscience is that the Georgia Council, with their budget, are seeking the federal funding. I'm going to say we used this phrase when we had the hearing in August. We got a lot of skin in the game here. That's not just state dollars. So so the power of this, I think, has been that there is a very significant and appreciated investment on the part of state government. And it's been real, and it's helped us grow. But there's also been this investment of federal dollars that we've gone out and, frankly, we've hustled. And the third is I'm happy to take a donation from the representative to the program anytime.
Great.
Trust me. I give enough in donation, but there's always room for more.
Okay, well, thank you.
I think the other addition is that when we moved the money to GVRA originally, part of the reason we did that was because they were going to be able to draw down additional federal dollars. When it was moved back to GCDD, I don't have the ability to do the same thing. So we lost potentially 21 million, I think was the number at one point, when it was moved. So there was the potential to have additional dollars.
You get an extra zero.
I got an extra
2.1 million.
2.1. I like lots of dollars, So we did lose that potential when we moved it out of that department. Thank you.
Well, thank you, Bob, so much. Persevere, okay? Persevere.
Thank you.
Thank you, and
I
thank you.
thank the members of the
Thank you for
committee.
your comments, but it's not me. It's a big old team effort that kind of makes all that work. So thank you.
There's times that the coach should take the accolades. How's that?
Thank you. Okay, so next we have Diane Willish. Oh, thank you for your help, Diane, for United Cerebral Palsy.
Good afternoon, Madam Chair and committee members. I am Diane Willish. I'm the CEO of United Cerebral Palsy of Georgia and South Carolina. I am also a board member of SPAD, the Service Provider Association for Developmental Disabilities, who I am here today representing. With an ask, I don't envy any of you having to sit in those chairs and listen to very worthy requests for support and funding. So you have an unenviable task, and I appreciate what you have to juggle and think about every day. What we are asking for is and I neglected to put on this handout to you, is $2.6 million. And what those funds would do is provide a 5% rate increase to specifically identified now and comp waiver services. You may recall in 2016 16, I believe, or it might have been 17, you all were gracious enough to support a rate increase in those waivers for specific services, particularly residential supports of kind of two configurations. One's called community residential alternatives and one's called community living services, but essentially providing supports to people to live in a home in the community, whatever that home may look like. Other services, those listed in red on the handout, were day supports and supported employment and service coordination, which were not a part of that rate study and rate increase that the state was good enough to fund. And what's happened is that those services are really struggling. You will see that I've pointed out to you that about 36.5% inflation, cost of living adjustments since those services last had an increase in 2003. And you might imagine, I mean, try to run your household like that. None of us would do very well. Those programs are really struggling to make ends meet, and more importantly, they're really struggling to retain staff because of turnover. Just yesterday, the day before, we got a national report of turnover in this field and the complexities and what's happening in providing direct support to individuals of all configurations. Kind of thinking back to the woman that was talking earlier about her family situation. Not only did she have a waiver, but even the cost to obtain a caregiver if they had the funds to be able to private pay are really, it's a real struggle. Georgia reported out a nearly 40% turnover rate in direct support personnel only in IDD services. That doesn't look at other long-term care settings, child care settings, and the like. So clearly there's an issue and a problem. During the fall, there was a House study committee on the workforce issues in Georgia and trying to develop ways to address those concerns. This kind of speaks to that these providers, these service entities would be able to make an adjustment in pay for individuals and just be able to keep the workforce steady. Adjusting rates for supported employment speaks to our commitment to being an employment first state and being able to incrementally get to a rate that supports that service delivery model. So we know that DBHDD engaged in a cost study for the residential services, the housing services. It started in 2014, and as I recall, and it took about 3 or 4 years. We know the department has a commitment to engage in a cost study to look at rates for all the waiver services. However, I'm not sure that it's prudent and in the best interest of the individuals we support or the providers that serve them to have to wait another 3 or 4 years. When we originally discussed this idea with the department in the summertime, we talked about this being a down payment on what that cost study is going to reveal, because we feel confident that it's going to demonstrate that the rates for all of these services, particularly daytime activities and employment, are sorely lagging. So it is what we think is a small request in the universe of pleads that you get for very worthy dollars, but we would be most appreciative if you could find the funds to recognize those very important services and the people that provide them. I'm happy to answer a question.
Do we have any questions? Well, I think you did a great deal, and you left us with some great information to refer to as well. So thank you, and thank you for the work and service that you do. Okay, next we have Dawn Alford.
Thank you, Madam Chair, members of the committee. I'm going to be very brief because I think, in actuality, a lot that I was going to cover has already been covered. And so I just want to thank you again for taking the time to hear us out. I am Dawn Alford, the Public Policy Director with the Georgia Council on Developmental Disabilities. And you heard Courtney speak so eloquently as to one of the reasons why I'm here, and I think she said said it all well and better than I can say it. Just to kind of go over just the technicality of it, as you all know, for the now and comp waivers, the governor has put 125 now and comp waivers into the budget, and just to, and I know I've met with you all, most of you individually, to kind of explain this, but the reason why we chose this ask is there was method in that we are trying to support DBHDD's multi-year plan that you all asked them to write and submit. So the 525 now and comp waivers, which is what our ask is of the General Assembly, would be to then add to the governor's 125 for 650, and that is if you look at DBHDD's multi-year plan that they developed for year 2, then 650 was the number that they came up with for year 2 of that plan. So I just wanted you all to understand the method of why we chose that ask, and I know I've also said this to you, but I want to say it to you all as a committee as well, and that I don't want it to appear that we are being greedy. I understand you all have a lot of asks and people who need help, but it's really, we hope that you can use this as a conversation, and if we can get, even if we can't get the full ask, which I realize is quite a hefty ask, if we can just make an effort potentially to see if we can add to what the governor put in, because you saw Courtney and her family and her face, and that's the reason we're here at DCD making this ask of you. I mean, I think you have the waiting list, you have the numbers, and that's where we are. I don't want to take up more of your time. Our other ask is, of course, with the inclusive post-secondary education. I think y'all have covered that well, but unless y'all have any questions, I just wanted to make sure y'all are good.
Okay, Representative Mathieu.
Thank you, Madam Chair. Dawn, I just want to thank you and Hannah personally, because you girls really spent some time with me, prepared me well, and thank you. Appreciate it.
Are there any other questions from the committee? Well, there is no doubt that you do prepare everyone well, so keep doing that, okay? You're a wonderful voice for those that cannot be here, and I think each and every one of us value your strong effort to be here and to keep us smart.
Thank
So
you
thank
so
you.
much. And I
Thank
just
you.
want to say how much I do appreciate you, Madam Chair, and your leadership, because I just want to echo what everyone has said. We wouldn't be where we are today without the work of yourself and your committee, and we just continue to appreciate everything you do to support the disability community. And I'm here for each of you. If you have any questions or concerns at any time, you know where to find me.
Thank you so much. Thank you. Okay, Ray Johnson with Bobby Dodd. Great.
Good afternoon, Madam Chair and committee. Thank you for the opportunity to speak on behalf of Bobby Dodd as a provider of services to those with disabilities, those that are disadvantaged, and veterans. I believe my colleague spoke yesterday regarding VR and our relationship with them, and provided a packet of information relative to who we are and the stories of the individuals that we serve. And we can talk about the compelling stories, much like the young lady spoke about earlier. We've got hundreds of those for the people that we serve. Last year we served approximately 2,200 individuals. About 900 were a direct result of the support that we received from DBHDD. And that represents about 20% of the income that we actually incur each year. So when we speak about when the commissioner spoke about the two key topics, one, provider relations and the rates, so that we can provide the services that we do provide in a quality manner, and then also workforce development. Two key areas for us, and particularly as it relates to supportive and custom supported employment that is directly supported by DBHDD. So we'd ask, continued consideration for the funds that they are targeting in those specific areas, because we see that as obviously a significant impact in this community.
Thank you, and I have visited there, and I want to get my committee to go back there too.
We would
after
love to have you there.
I know the great work they're doing.
Yeah.
It's very eye-opening to see it, so I appreciate that. Are there any questions among the committee at all?
Thank you.
Thank you so much, and thank you for sitting with us today. I know you've heard
My
some
pleasure.
heartfelt stories.
Thank you.
Okay, let's see. Okay, I'm going to do my best. I'm going to say one name, Sasha. Sasha? Yes, great. And you're going to come tell us the rest of your name and make sure I say it right when you come to the microphone. And Sasha, you may need to move that microphone down a little closer. I've had someone text me though that we're good, we can be heard. There's just a little bit of static, but we're trying to adjust it every now and then. So. Whenever you're ready, we're ready.
Yes. Madam Chair, members of the subcommittee, good afternoon. Thank you for allowing me the opportunity to be here today to speak with you all in regarding Imani Within Foundation request for the fiscal year of 2020 budget. My name is Sashi Amigeti, and I'm the founder and CEO of Imani Within Foundation. And what we do, we provide outreach programs and workshops that facilitate mental and emotional healing and wellness. And I would like to share a little bit about my own story, briefly. So in 2014, December 2014, I was diagnosed with anxiety. The type of anxiety I have is panic disorder, as well as major depression. And after me being diagnosed, it took a while for me to get the help that I needed to be, living in healthy recovery. I started to research and educate myself on my mental condition, and then from there, it led me to that self-acceptance that I needed for myself. So I discovered so much. I discovered literally as a child, I had panic-like symptoms that I wasn't even aware of. Growing from, the environment that I came from, I was raised by a strong black woman, who was raised by a strong black woman. And the way she raised me was what she knew best. I was belittled at times. I was insulted. Instead of me being acknowledged of the efforts that I put in, I was told constantly that I can do more, I can do better, So guess what? That resulted in me becoming an adult that internalized the message that I wasn't enough. I also discovered, from me being a victim of sexual assault at 16, I learned and understood that how trauma can impact the human's functioning from physical, mental, spiritual, behavioral. And from there led me to creating Imani Within Foundation. Imani means faith in East African language, Swahili. So we tend to not only restore the faith, but we give them the programs, the workshops, the connections that they need, that awareness that they need. So I'm here today in regards to one of our workshops, which is the mindfulness workshop. And it should be on one of the pages, as you see at the second page, that has our logo on it, and our logo is with the hands, the colorful hands. And it gives you a breakdown of our mindfulness workshop that we offer. So I've been providing this to the Fulton County, Metro Atlanta public schools, the high schools mainly, and we've been working with teens, adolescents from 12 to 18 over the past 2 years. And in our mindfulness workshops, we have 3 segments, as you can see. So our 3 segments, we have the Brainy Max. Then that's one of a segment. And then we have the Web of Truths. Yes. Okay, just making sure you follow along. Yeah, so with the Brainy Max, basically, as you see, has the breakdown. The Brainy Max, most of our male adolescents love that, and that's when they do the partnership, and we teach them the breakdown of how the mind and the brain works. So it's a hands-on activity. And then with the Web of Truths, we basically, the females love that, the adolescents, the females, they love that one. And that's when we get in a circle, and it's a ball of yarn in between all of us. And basically, I go first. I share my own truths in regards to after we pass around the quotes that relates to us the best. And I share the quote that I've chosen, and I express how that relates to me, how I was able to overcome that obstacle in my life. And if you can relate to me, you'll pick up a piece of the barn as well, and we create that web of truths that basically shows that you're not alone, and that you're not abnormal, basically. So with that being said, basically just the overall mindfulness activity, the workshop that we offer, is just one thing that we believe. We just believe that our kids, our children are the future, and we understand that if we work with the kids, we indirectly work with the parents, and we build on that community that we all want. So that, so that's a little brief about who I am, what we do. I've had my nonprofit since 2013, but we only been working on this program for 2 years. So the beginning of, we've had multiple programs, and one of our, when I say our fantastic, phenomenal event that we do for the past 4 years is our Let Your Light Shine, and that's how we first got connected with a lot of the Fulton County and the Metro Atlanta Public Schools, because our Let Your Light Shine is an outdoor festival that focuses on depression and suicide awareness. So that's how we first got in connection with the schools, and the kids would come out and they would perform. And we create this platform of those who have been diagnosed with a mental condition, or for those who may have a family member or loved one or just want to know more about it. We spread that awareness at our event, and we do it every year in May for Mental Health Awareness Month. And us coming up again, May 11th is our event. So this will be our 4th year doing it. This event that we do, it's phenomenal. We not only connect with the high schools, we connect with other organizations. We've been in partnership with Boys and Girls Clubs, and our donors that we have had over the years been Kroger's, Publix. So it's just been a blessing. So I'll leave it open for any questions.
Representative Morris, I'm sorry, I'm looking like, wait a minute, who is that number? I'm sorry.
I'm just curious, are you anxious now?
Yes.
You are?
Yes.
But you're not in a full-blown panic
No,
attack.
no.
You say 1 to 10.
Yes.
On a scale of 1 to 10,
Ooh, I
how
think
would you feel?
7.
It takes a lot of courage. I've had
Thank
panic
you.
disorder since I was 5 years old.
Thank you.
And it's, I'm glad you're doing what you're doing, because it's hard for somebody who doesn't understand. I think everybody's had a panic attack at one time or another, but people with this condition can have this 25, 30 times a day, more.
Yes.
And it's really hard to function. So it takes a lot of courage. People don't understand. You look normal, but
Maybe even beautiful,
well,
more
yeah,
than normal. I mean,
it's,
really, very together, actually.
I mean, yeah, you have this what if thinking.
Thank you.
What if I freak out in front of these people? What if I freak out, it's gonna mess up my, and it can go, and it can be debilitating. So you've got a lot of courage to do what you do. It takes a lot.
Yeah.
Thank you.
I agree. Absolutely turn it around. You're a strong example of that, so thank you. Anything else, Chairman?
No, not at all.
Okay, Representative Mathia.
Thank you. You did great.
Thank
You
you.
talked as fast as I can sometimes. Okay, it's usually, I understand, 12 to 18, high school mostly. How many workshops a year?
So now we have worked with Carver High School. We've worked with Benjamin E. Mays so far, and right now we actually already we already spoke with the counselors and principals at Maynard, but the only issue with a lot of these schools are getting the signature from the parents, because we first approached them to have this workshop during the day, during school hours, and with Maynard and a lot of other high schools that wants to do this workshop, they've been having issues with the kids bringing back the slips. So that's why this request is for us to do it in after-school program, so we can have a budget for transportation.
Okay, that was going to be my next
Yeah.
question. Is that why it's?
Yes.
That's why you had an ask for transportation. So, you're trying to hold it after school or weekends and weekends?
Or weekends.
And or.
Yes.
Okay. Thank you. Great job.
Thank you.
Representative Henson.
Thank you. I heard just a little, heard your presentation. I mean, in terms, you presented well. Are you talking about folks with panic attacks or anxiety, or both?
Both. So our program is basically so people can have more of a self-awareness. So through my journey of recovery, I've learned what worked for me. And for me, group support and therapy, also practicing mindfulness. And one thing about mindfulness is just being attuned to your feelings, at that present moment, so you can make conscious decisions to change. And that's one thing we do. We basically focus on cognitive skills through our mindfulness workshops. So they just have that self-awareness. So they understand, why are you acting out, or, so they have an understanding of their own feelings, Am I explaining that? Okay.
Yeah,
Great.
I do want to talk to you further, just because a young lady that I know is going through a lot of issues with anxiety attacks, which explains some from the past and some of the things that she was reluctant to do. And I think it's good, because they can manifest themselves, and they really can be debilitating and keep you from the level you've been achieving at, or could achieve at, from doing that. So if you also, I know you gave out some handouts, you can get me one on your way back to your seat, that would be great. Thank you very much.
I was just gonna
Chairman
add
Morris.
that, and two, that was kind of what, Representative Henson said. This anxiety disorder will manifest itself if it's not treated with, self-medication. I mean, you cannot not seek help. And, a lot of people is seeing I mean, I'm not against saying prescribe, but there's drug addictions and there's alcohol addiction, and it's, and people don't understand where the behavior's coming from. It's not necessarily bad behavior. You're trying to escape a very painful, difficult thing so you can just function. So the treating early on and understand, that they're not crazy.
Yes.
That it's not, they're not abnormal. They have a condition that probably happened when they were 5 years old or so.
Yes.
This triggering event that I learned about. So the faster somebody understands, I didn't understand. I mean, there's plenty wrong with me, but I was in my mid-20s before I understood that I actually, had a condition, not, just absolutely nuts. I did have, I was gonna say one thing last. Now, one of the nicest things that one of the counselors that I used to try to help me with this to understand it, made me feel better, is she said that the best gardens grow the biggest weeds. And a person who has this has just this extraordinary imagination. If you know somebody that has anxiety disorder and panic attacks, that's why they have them, because they can imagine the worst possible scenario happening, you know, any minute now, but they are highly imaginative, highly sensitive. So I applaud what you're doing for the younger folks to understand that they can, that it can be controlled and it can be understood.
Yes, thank you.
Can't overcome.
Thank you. Professor Donahue.
Again, very good job. Thank you. Let me ask a question to clarify. When you're putting together Atlanta Public Schools 89 learning sites, including 61 neighborhood schools, 5 partner schools, 18 charter schools, 2 citywide single gender academies, 3 alternative schools, and 4 alternative programs. What is the single gender academies?
I actually got that from the Atlanta Public Schools website, and that was just the list of the schools that they had, and that, you know, that was under them.
Okay. Okay. Yeah, and that's what I would think. That's why I would want to make, like, Burnell College up in Gainesville where I'm at was an all-female school that now they have taken men in under different programs. But that was just something, but not a problem. Thank you.
I believe there are too, and y'all who are closer to Atlanta may know that, but I believe there are 2 schools that are, one's for girls and one for boys, and it's a pretty strong program from what I've read. But I'm like you, I've read about it. So, yeah.
Thank you.
Are there any other questions? Well, I want to encourage you. I know you've tried to meet with me, and I've been hard to catch, and we're going to catch up. Okay, we may have to get some of this work done on this budget first, because that's why I'm not as much in my office. But I do want to sit down and talk to you, and I think I want to hear more away from the microphones, basically, about some of the resources you may have tapped into, and let's see what we can do to help you find some more, because I think you're doing a very good thing. So thank you. Thank you for your
all
courage,
for your time.
especially.
Yes.
Okay, so we have one more that I know of, and then we'll make sure for Shelley Simmons, please, if you can. Please. And Shelley is with the Statewide Independent Living Council of Georgia.
Good afternoon. Thank you so much for the opportunity, Madam Chairman. To the other members of the committee, thank you so much. Once again, my name is Shelley Simmons. I'm the Executive Director for the Statewide Independent Living Council, what we call SILC. It is our job to work closely with our legislature and other stakeholders to help create policy change that will benefit individuals with disabilities. We also work very closely with our centers for independent living, and we have 9 centers throughout the state. And please forgive me, I did not come prepared to speak with you today. My main reason was to say thank you. Last year, we have been advocating for what we call center expansion. Again, we have 9 centers throughout the state that are consumer-driven. They're run by individuals with disabilities, providing services to people with disabilities. However, there is a big hole in the state that is not covered by a center. In fact, there were 59 counties that are not, that were not being served. We have been advocating for years for center expansion, and last year this committee was key, instrumental in providing funding for us to open up a satellite office in the southwestern region of the state. We did a mass mail out, and I hope that all of you received some of this information, but if not, I would love to be able to supply it to you once again. I did not want to come to you because I wanted to be able to come back to you and let you know that we were good stewards of the money, of the funding, but unfortunately, because of Hurricane Michael, it's been a little bit slow getting things off the ground. We do have a office right now in Valdosta, but the main center, which is Bainbridge, or Bain Incorporated in Bainbridge, received a lot of damage, so they've really just been getting themselves back up and running. But I did not want to lose the momentum and asking for our center expansion. Our ask is $800,000, and this will provide 5 satellite offices around the state, and also help fill in that, what we call the unserved or the white area. Again, I will get this information to you, but I know that is a large ask, but that 800,000 again will provide 5 satellite offices, operational costs as well. So we have a map, and I'll get that information to you. If you did not receive our mailing, I do apologize. We tried to make sure that we had everybody on the list. But we do have what we call Independent Living Day at the Capitol, March 19th. We would love for you to get to know about who we are and what we do. We're small organizations, but we do great work. But again, it could not start without the support of this committee, and in particular, Madam Chairman Dempsey. Thank you so much for your support, and we hope that we can, if not all of it, some of it, but we would love to keep that momentum growing, because there are currently at least 1 million people with disabilities not receiving services for one of our centers. So we ask that you consider us, keep us in your mind, and I would love to be able to answer any questions and or even offer you a tour at one of our centers if they're in your area. Any questions?
Thank you, Shelley. We do have some questions. So first of all, Representative Donahue.
Thank you again. Let me ask a question. You said $800,000 is your ask for 5 satellite offices.
Correct.
How many people will be employed in each of the satellite offices in that figure?
I'm so sorry.
No.
Depending on where the office is, it can be ranged from anywhere from 2 to 3 people.
Yes, ma'am.
But it will cover various counties. So there will be a building or brick and mortar, but a lot of that will be spent on outreach going into those outer counties to provide services. So depending on how many counties each of the satellite offices pick up, will determine how many people will be employed.
May I ask another?
Absolutely.
And thank you. With that, how will you select, or have you already selected? There's 59 counties not really covered, correct? So how have you selected what counties a satellite office each one would go into?
Well, last year we were able to, with the funding, cover additional 14 counties in the southwest region of the state. And that was a kind of a big number. But from our board meetings and the center directors, we were able to divide up how the centers would take on those satellite offices. The satellite offices will be attached to an existing center to help get that on the ground.
Thank you.
Thank you. Representative Mathiak.
I thought I heard you. Thank you for being here. I appreciate it. Thank you, Madam Chair. I thought I heard you say something about March 19th. Is that your Capitol Day? Is that what I heard you say?
Yes.
Okay.
We call it Independent Living Day at the Capitol, and we'll have a lot of people, consumers from the centers that will come to the area, come to the Capitol to meet with their representatives, and also we invited the legislature as well for everyone to get to know who we are and what we do. So we hope that you'll be able to stop by. I'll send that information out as well.
Thank you.
Any other questions?
Thank you. Are there any other questions? Well, thank you so much for being here. I know the good work you do, and I appreciate you. Thank you.
Appreciate it. And again,
Thank you.
Thank you so much.
And I will tell you this, though. If you do have that information and you can email to it kind of quickly to me and to
Absolutely.
Michael, we're going to be working on this budget kind of quick. So
Okay.
let
I
us know.
appreciate it. Thank you.
Thank you. Are there any others who wish to speak that didn't sign up? Well, I want to thank y'all. I know we have long meetings, but they're meaningful. And Representative Howard, you may have been out of the room. I wanted to make sure and go back and emphasize that some of the questions that came up about waivers, it's part of the 5-year plan that DBHCD is working very hard, very diligently on right now. We will have more information on that very soon, and it's a strategic implementation. The numbers were talked about, Representative Howard, and basically I think the numbers they were using was to every 600 cost about $16.3 million. That's the estimate. So, you know, it's very expensive. It's a process. We need to continue to work on it, and we'll see what we can find, right? Okay, if there is no further business, then we are adjourned for today. Thank you.